The demand for qualified nurses is high across the nation, and it is expected to increase over the next several years. Since there is such a high nursing demand, admission into nursing school has become a competitive process. Imagine being a patient in an emergency room, or you have a child in the emergency room. Last thing you want to do is wait. The wait is already long because of the number of patients. Would you be prepared to wait because there isn't a nurse available? The popular assumption is that when you go to a hospital, the hospital will be accurately staffed to meet patient needs. As with any other industry, it's supply and demand. There aren't enough qualified programs or instructors to meet the demand. It's a challenge to get into top-ranked nursing programs because of the onslaught of applications. Today, we will discuss the nursing shortage and how it impacts patient care. This is Carlos Rhodes with Group 10 Action News in the Field Live, talking to Tracy about the nursing shortage and how it impacts patient care. Tracy, tell me, why did you want to become a nurse?
Well, I actually came from a long line of family nurses, and that impacted me greatly. And I also just have always had a caring, tender heart, and just felt that there was a need for someone like me in the medical field.
Okay. What nursing school did you go to?
I graduated from Panola College in Carthage, Texas. It's in East Texas.
Was the application process a deterrent? Did it take you a long time to get in?
I actually initially enrolled at Kilgore College, and there was a waiting period there. So I chose Panola College, which was a little bit further away, and I was able to get in with the next semester. So that period wasn't too long. So.
How long did it take you to get into school once you applied?
Once I applied, there was about a 3-month
waiting period. Okay. And once you graduated, how long did it take you to find a job in your field?
In my field, well, initially I was able to work under a GVN, which is Graduate Vocational Nursing License. So I was actually able to become employed in about, I would say about 30 days. So it wasn't too terribly long.
Okay, and from a nursing perspective, how has the nursing shortage impacted patient care?
Well, that I have seen firsthand, and has really impacted patient care in nursing homes, in hospitals. You see a lot more negligence, unfortunately, probably an increase of infections, secondary infections, that type of thing. So, of course, on the personal side, you would have employee discord, and then, of course, patient complaints, that type of thing. So it has greatly affected the medical field.
Do you think it was a competitive process trying to get into nursing school?
Yes, it was. I know it has changed a lot since I graduated, but they do require you to take multiple type tests, aptitude tests, and then they interview you at times as well. So there is a screening process. It's pretty strict.
Are you interested in pursuing your RN or BSN?
Actually, I am. I hope to start. I had started at one time, had a little delay with family, but I actually plan on starting again before this year is over.
Will Trinity Park offer any tuition reimbursement for that?
They do actually, which I'm very excited about. I have to be employed for a certain amount of time, and then I can start using their program they have towards my tuition and everything. So yes, I'm excited about that.
Do you have any aspirations to continue for maybe your doctorate in nursing or anything like that, or would you be satisfied with just patient care?
Well, actually, my long-term goal is to become, or actually to be in the administrative field, to get my bachelor's and at some point my master's. So that is, I've done it on a small level as a supervisor at a BGYN clinic, and I really enjoyed that. So I would really like to continue that. So.
Okay. Well, thank you very much. This is Carlos Rhodes signing off. This is Carlos Rhodes live with Group 10 News. Now back to the newsroom with Tyrell and Bube.
All right. Thanks, Carla. Thanks. I think I have the feed. Thanks. This is Tyrell Taplin. This is my counterpart, Bube. So as Carla talked to you guys about the nursing industry and the nursing shortage and all the competition here in the DFW area as it relates to nursing school and the shortages, let's talk about the immediate challenges and really how those nursing shortages affects patient care and also the hospital as a whole. So let's talk about what we do know. What we do know that the competition to get in nursing schools are very, it's pretty quite competitive. Would you agree, Bube?
Yeah, that's right.
Yeah. So, but nursing is one of the fastest industries, and it's one of the most guaranteed industries here in the U.S. It is a stable career, but it's grossly understaffed. Okay, so that's a huge variable. Another huge variable is that the average nurse age is about 50 years or older, and so that means that they're really gearing towards retirement. And as a effect, this is part of the baby boomers generation, and so their health is also starting to decline. They're not able to lift as many patients. They're not able to stand as longer. So them too are experiencing their own health challenges. So they're kind of more forced away from the industry, to say the least of words. Another immediate challenge is the healthcare reform. The healthcare reform, and we will have more information on that whenever the government decides that in March of 2013. But pretty much that is a proposal that everyone is going to have access to healthcare. So if you couple that with the current nursing shortage, coupled with everyone having access, then we're already at a standstill with the demand severely outweighing the supply. So that's just going to really just triple it, if not. So let's talk about the patient care and how that's affected. So as I talked earlier, staffing issue, okay? The staffing issues is you're constantly working nurses to the bone. They have to take over a lot of patients, and of course, you have to. The industry standards, you will like it anywhere from 1 to 6 patients, depending on the acuity. That's in the med surg type of unit, tele unit. But on the ICU, of course, it's going to be limited to like 1 to 2. But what we're seeing is, of course, that's based on acuity. But what we're seeing is that a lot of nurses are so overworked that they're taking on more patients. They have to do more total patient care. So meaning that they have to do everything from taking care of the patient, charting the patient, giving the medication, and that really ties into stress. It ties into stress and job satisfaction. As a result, many leave this already scarce profession because they feel like they're just working a lot. Another issue is that many hospitals, they went to a 12-hour shift, okay? 212, 7A to 7P, or 7P to 7A. And in theory, it really was good in theory. It really was, because it actually saved money on the front end. But on the back end, what happened was you have all of these nurses who are used to working 8-hour shifts, and though it saved the organization money in terms of salary or benefits per se, it really increased the satisfaction, because you have a lot of nurses who have to stand up 12 hours a day, and nursing standing up is really toxic on your body. According to a survey on nurses.com, and I think that you will find this interesting, Bube, about 20% of deaths occur each year because of medication errors or medical errors. So we're talking about about as many as 20,000 deaths each year as a result of the nursing shortage, because of they're not getting the proper diagnosis. They're doing it too. They're not doing the medications on time. They're not taking care of the patients on time. Why? This is all a directive from the patient, from the nurses shortage, and also kind of really ties into the diagnosis. Say for example, if I'm a nurse and I'm already overworked, I'm doing all these other different kind of things. I'm charting. I'm taking care of this patient. I'm dealing with the family in this room, and I have a diabetic patient in this room. If I'm overworked as a nurse, I'm not going to have time to properly assess that patient, properly monitor that patient, and I probably could that patient can go into a diabetic shock whenever that could have been prevented by me actually monitoring my patient correctly, assessing my patient correctly, and that could have been avoided by giving them a apple juice, orange juice, something to bring that blood sugar down. Now, of course, that's on a higher end, but things like that does happen. Okay. Another thing, which is huge, is the nursing shortage. Really, it takes an impact on the hospital or an organization as a whole. A lot of us know, and we've read this in our books whenever we about physician relations as well as clinical operations. In our book, it really kind of drove in on patient satisfaction surveys and how really the organization is really governed by those satisfactions. Why? Why is that? Well, you ask yourself, because they're governed by that because it's word of mouth. Okay, we as an organization, we want to know, how are we treating our patient? Okay, because I guarantee you, whenever the patient leaves our organization and our hospital, they're going to go out and talk. But more importantly, the families are going to go out and talk. So really, that word of mouth is really going to be our best and worst marketing. But also, it's also an opportunity. So for us to analyze what we're doing well and what we're not doing so well. And each year, hospitals, they get together, they strategize about that. And that's really how they really determine a lot of services that they want to offer their patients. Well, if our nursing shortage is shortened and the patients are not receiving the level of care that they want from the nurses because of the shortage, then of course it's going to impact everyone as a whole. So that's a key factor. Also, because of the patients are not getting diagnosis correctly, what's happening? They're actually staying longer in the hospital because of misdiagnosis. Their condition is actually getting worse when they go to the hospital. And so what happens on the bigger scale of things? What happens is it causes loss of reimbursement from the insurance perspective. Typically, the longer a patient stays in an acute care setting, the longer that they stay, the less money is received from the insurance, and so that really impacts substantially amount if we're not diagnosing our patients on a proper in a proper time frame. And lastly, this one was another key factor, because of the industry. Because of the industry is so scarce and the staffing is so limited, a lot of organizations have to be they're forced to go to outside agencies, such as a health agency or even a traveling agency. So because of that, hospitals pay excess of $1,000 each year to bring in these these nurses. And what happens is, say for example, a base rate for a nurse is $25 to $30. Well, whenever they bring in an agency or a traveling nurses, we're looking at $60, $75, anywhere from 2 to 3 times a base salary. Well, that really impacts the organization as a whole, because all that money could be better utilized by improving patient services, new equipment. That new equipment that's really going to lessen the nurse's workload. Okay, we have all this technology that's coming out these days, but we can't invest in that because it's not in our budget. Why? Because we're paying up to $250,000 in agency fees. More staff, okay? Those fees can be better utilized in recruitment efforts, okay? So that's a good thing. And also facility improvement, or really any type of services that are a direct derivative from the patient satisfaction surveys. So again, we talked about the immediate challenges of the nursing shortage. We talked about how patient care is directly affected, which is really which is all about. And in addition, we talked about the impact of the hospital organization as a whole. And what Bube is going to do, he is going to really tie it in all together, and he's going to tell us how do we fix so Bube, if you want to take it away and let us know, how do we fix this epidemic?
All right, thank you, Ty. Right now today, nursing shortage is a very real and difficult issue, and it's been experienced in the past. The nursing shortage has stimulated the intent of all sectors of the healthcare industry, and this has been seen in the population, the age population. As baby boomers age, it's very likely that demand for nursing care will increase, and the tax healthcare system in America. And also, there are more options for women. A lot of women right now have left nursing for other professions, and not enough men have entered to take their place. Also, they've given some recommendations to fight the issue of nursing shortage, and this has been seen in the increase the supply of nurses through more effective recruitment, and also the increase in supply of nurses through expanded educational capacity and opportunity. Recently, a survey was taken from a group of nursing officers, and the following was found. It was found that the number one concern for nurses was their increased daily work. The workload for nurses, they see it as too tedious, so they find it difficult to cope. And also the nurses are confused about the financial issues surrounding their work environment. And some of the nurses also feel that the image of nursing is very poor, and this has affected the environment. And talking about image, what the public thinks about nurses generally has a lot to do with the nursing profession. And recently there's been news of striking nurses, and because of managed care, stories of nursing errors that have injured and killed some patients. And the nurses must become more of a voice in the press. And also there has been some suggestions from nurses, from a survey from nurses, and they can be categorized in three aspects: the workload and the work environment of nurses, the financial aspect, and the respect and support for nurses. Talking about the workload and the work environment, it's been recommended that there has to be a decrease in the individual workload. And how can this be? By providing support staff for nurses, clerical staff, nurse technicians, and transport technicians to help decrease the workload for nurses. And also the financial aspect, it's been said that nurses have to be, the salaries have to be revisited, increase salaries. Not only just the salaries, they have to be given some kind of incentives. So they have to employ signs and bonuses and retention bonuses also to help nurses in the profession, to make the profession more graceful, and to encourage physicians to treat nurses as colleagues and not just as regular nurses as people see them to be. And also the AACN, the American Association of Colleges of Nurses, have also released recommendations for nurses to address the issue of nursing shortages. And education is a major aspect. Education and training of nurses, orientation of nurses. There has to be a support to help support healthcare employers to create and sustain staff development, and also to reach out to youths within the ages of 12 to 18 through counselors, youth organizations, schools, and other outlets to promote recruitment of a younger, more diverse population of nursing students. To create a partnership environment that advances the practice of nursing by establishing appropriate management structures within the healthcare system to ensure adequate nursing staffing. Thank you very much.
This concludes our brief segment about nursing the shortage and how we can bridge the gap. This is from the Group 10 Fox News Show. Have a great day.